Good morning, everyone. Welcome back to our English communication series. Today, we are tackling three interconnect and vital areas: how we listen to and talk about pain, how we monitor and report change in our patients, and how we communicate regarding laboratory tests. Let's enhance your English skill for this critical task. By the end of this session, you will be equipped with the English term needed to assess pain effectively, discuss patient monitoring, and handle communicate about lab tests. We will practice both listening and speaking in realistic nurse scenario. Pain monitoring and labs are deeply connected. The communication is a thread that tie them together. We constantly need to listen to our patient and requirement and speak clearly to patient families and their healthcare teams. Good listening skills here are non-negotiable for safety. We discussed about PQRST before, right? But pain assessment is more. We use various scales like the numeric or phase scales. Especially for different populations, we must listen with our eyes too, observing nonverbal cues. And cruelly, we must remember that culture strongly influences how pain is expressed or hidden. When listening to a patient talk about pain, listen beyond the surface. What words do they use? How intense it is? Are they anxious? Are they perhaps hiding their pain due to cultural belief? Sometimes what isn't said is just as important. Here are key English phrases for asking about pain. Start with a direct question, then use PQRST. Be ready to adapt your question, especially for non-verbal patients or different cultural background. Speak clearly and show empathy. Like for the first one, initial question. Are you having any pain right now? Can you tell me more about your pain? And for quantifying pain, can you rate your pain on the scale of 0 to 10? Put the numeric one. What does the pain feel like? And let some students to point out on the face scale. For contributing factors, does anything making it better or worse? For non-verbal cue, I noticed you are grimsy. Are you uncomfortable? Something like that. Now let's practice. Work in pair again. One person is a nurse and the other is Mr. Sompong or any name, create a patient who is hesitant to admit pain. The nurse needs to use good listening, observation, and sensitive English questions to understand the real situation. Then switch with your friend. Okay, this is the scenario we provide to you. Nurse and patient. Okay, the patient scenario is the elderly Thai man. Basic English believes showing pain is weak, so he hated the pain. Has knee pain 5 out of 10, but say it's okay a little bit, but it's worse when moving. Okay? Nurse, you have to use your English question. Observe non-verbal cue. He's acting something like that, and be culturally sensitive to assess pain accurately. Now then, monitoring isn't just watching number. We need to listen to alarm, to breathing sounds, and what the patient tells us. Even if it's vague like, I feel funny, you have to think about that. We also listen with our eyes, observing any visual change. All these are important data points, like monitor alarm, breathing sound, patient report is important. Actually, when you see the monitor in the ward, okay, when they have alarm, please go to the alarm to see the monitor what's happened, and then use your eye, okay, observe the patient as well. When monitoring real change, we need to speak clearly. We use S-bar to report to doctor. We need to explain alarms to reduce patient anxiety. We reassure patient and instruct them on what to repeat to us or in clear English. Okay, like report like this, report checking and explain. We start with the first one, S-bar, right? The S. Situation like Miss Dr. Lee, this is Nurse Pim calling about Mr. Chen in room 201. Tell the situation first. And then B, background. Tell about the patient background. He is post-op day 2 from a hip replacement. Okay, we come to the A, assessment. Assessment, you have to tell the doctor what that you have assessed from the patient. His oxygen level dropped to 85%, and his report is increased pain. He got shortness of breathing, something like that. And then with our recommendation, I recommend we administer oxygen and re-evaluation, something like that. Okay, and then the doctor will give the information, give the order after that. But you have to report in S-bar first. Imagine you are taking over the ship. Listen to this handover report in English. What are the 2 most important things you need to monitor closely for Mr. David? Okay, I will read the script now. Okay, listen. During the handover script. Okay, about Mrs. Davis in room 305. She's post-op day 2 hip replacement. Her vitals have been stable, but listen, her BP trend up this afternoon to 160 over 95. Pain is managed by with paracetamol. She rated it 3 out of 10. However, monitor her cuff closely. She reports some tenderness. It looks a bit red. Labs are pending. So, what did you hear? Discuss with your friend and then answer. Okay, we go on further. Now we come to the lab. We also need to know the English name and abbreviation for common lab tests. Here are some you will frequently hear to read. CBC for blood count, okay? BMP for electrolyte and kidney function. But sometimes they use like chemistry. LFTS like for liver function test. COG for clotting. UA for urine analysis, and like blood culture is like to do like the hemoculture. Okay, sometimes they will use like abbreviation on the wall. You have to understand it. But maybe for the lab test, okay, you have to learn how they use it in the hospital as well. Communication around lab involves both listening to order, results, and patient questions, and also speaking to confirm, to explain, and to report. We need to be clear and use simple English when explain procedure to patient. Don't try to use like the medical terminology with the patient because sometimes they cannot understand you. Okay, when you're listening, understanding verbal order for labs, hearing result, report over the phone, listening to patient question like, why do I need to do this blood test? It will be heard, something like that, and then you have to speak out like confirm orders to explain the procedure, and also report. Okay, some like result to the doctor as well. And sometimes if the patient want to know about the result, please consult your doctor first and then communicate with them. Let's test our standing. Match this common English lab test to their primary purpose. Okay, we will start now. For the lab test, number 1, match with B. Okay, check for infection like anemia, white blood cell. Number two, glucose is in BMP. What is math? Met with A, check for diabetes blood sugar. And 3, blood culture. Met with D, check for the bacteria in the bloodstream. And 4, met with C, to check for the breathing risks. Okay, knowing the purpose helps us to understand why we are doing this test. It's a practice time. One of you is the nurse and the other is the doctor. The nurse has a critical lab results, a very high potassium. Use S-bar, remember? In English, to call the doctor and report this urgently. The doctor should listen and respond. Let's hear it. Okay. For this scenario, please look carefully and practice. And now let's put everything together with case study of Mr. Garcia. He has significant pain, abnormal vital signs, needing monitoring, and lab test order and result. He also has strong accent, adding a listening challenge. Mr. Garcia, he is 50 years old, have severe right lower quadrant pain, suspected appendicitis, strong accent. For current status, pain is 9 out of 10, stabbing, constant, and restless. His temperature is 38.9, heart rate is 125, respiratory rate is 26, BP is 140 over 90 and have tachycardia. For lab orders, we have CBC, BMP, need to draw blood, and red blood cell is high, 18.5. In your group, listen to each other, ideas about Mr. Garcia. What is the most critical information? Then plan how you would speak to the surgeon. Use S-bar. Okay, we go back to S-bar again. Make sure you include the pain assessment, the vital sign, and critical lab value in your report. Be ready to present your S-bar plan. Okay, this is a quick review for some key English phrase for pain, monitoring, and lab. Also remember some are the simple listening phrase like can you repeat that to make sure, okay? Or let me confirm, because in this topic the confirmation is very important, okay? They are very useful when communicating in English. Pain assessment, phase, monitoring vital sign, lab procedure and result, and also general clarification. This 4 phrases is very useful for you. Do you have any final questions today? Okay, remember, being confident in English communication takes practice. Keep listening, keep speaking, and never be afraid to ask if you don't understand. Thank you for your hard work.